Hello and welcome to this interview, which is part of Young Forum Gastein 2021. Today I'm joined here with Matthias Wismar. Matthias, if you could please briefly introduce yourself.
Thank you so much, Aysel. My name is Matthias Wismar. I'm Program Manager with the European Observatory in Health Systems and Policies, and our mission is to support evidence-informed policymaking. And we are doing this by monitoring health systems reforms, analysis, health systems performance assessment, and a lot of knowledge brokering and dissemination.
Great. And as for myself, my name is Aysel Rahimli. I'm a program coordinator for Human Resources for Health programs at Wemos, which is a lobby and advocacy NGO based in the Netherlands. And I'm also a young Gasteiner from the cohort of 2021. So thank you very much, Matthias, for being here today. My first question is related to governance and the function that it serves. Could you please define what governance is and what is this function within the healthcare systems?
With pleasure, Aysel. Governance is defined as the way we make collective decisions and implement them. And already this definition tells you that it's a key lever, actually. It's a key lever to mobilize in times of crisis, health workforce, finance, delivery models. And funnily enough, very often governance is almost invisible. So when people talk about finance, payment systems, and all this kind of stuff, we don't see this. But now in the crisis, actually, we have seen this very well. And very often key aspects of governance are transparency, accountability, participation, and integrity.
Okay, great. Thank you very much. Next, I want to ask you about, related to governance as well, what are the three key priority areas where the European healthcare systems can learn from each other, and how could they improve their ability to do so?
Yes, I think number one is actually, and has been a priority for many, many years, care integration. We still need to better integrate our healthcare systems with a focus on primary care, but also the transitional care between hospitals and primary care settings. And part of this is actually also digitalization, which is almost an end in itself. It's also the health workforce, that we need to, that we have a very strong, resilient, and agile health workforce. And last but not least, we need to better regulate the context of care integration. So care integration, digitalization, and the health workforce would be still priority areas.
Okay, that's fantastic. Next, I want to ask you about resilience and solidarity. Could you define what it is to be resilient and in solidarity? And can you briefly also let us know if there is a way to keep member states accountable for their solidarity?
Okay, so resilience is defined actually as the capacity of systems to absorb external shocks, like the economic and financial crisis, of course, the pandemic, and probably the next crisis just around the corner. The fallout from the pandemic will be a financial fallout, and we all hope that countries are not resorting to austerity policy, which would be a new crisis again. Solidarity is a little bit more difficult to define. Of course, we all know that the rich help the poor, the healthy, the sick. But what does it mean actually in particular circumstances? We've seen actually in Europe an unprecedented level of solidarity with the purchase of vaccine, where we have purchased Europe-wide for all countries, small and big ones, powerful and less powerful, and affluent and less affluent countries, where we have purchased Europe-wide vaccines, and everybody had access to this. So this was quite unprecedented.
I want to now ask you about the strategies, or perhaps a combination of strategies that are pivotal when it comes to enhancing resilience in healthcare systems, and particularly in the European region.
Well, coming back to my first answer, of course, governance is key, and you can figure that without good leadership, without adequate policies, and without the ability to implement these strategies, all other things will certainly fail. But as you say, it's a combination. It's not just governance alone. We also need to have the right financial strategies, that we send the money where it needs to be in times of crisis. We need to be we need to have the ability to enact a health workforce upsurge, you know, to reshuffle a little bit the health workforce, to reactivate people that are no longer working in the health workforce, to integrate volunteers. We need to be able to strengthen our public health institutions. Remember about the testing and tracing, that we have enough people there, that they are trained to do this. And of course, we also need to deliver our we need to transform our delivery systems very quickly, that we can separate, like, for example, in primary care, the infected people from the not infected people, that we can include remote consultations, that we can change the way patients are treated in hospitals, so that the intensive care units are open for the emergency cases. So I think that there are, across the whole board of health systems function, key strategies to respond to COVID-19 and to strengthen health systems resilience.
Next, I want to ask you if you can just outline some of the main challenges and solutions, if possible, to having a well-functioning monitoring, surveillance, and early warning systems.
Well, first of all, it's certainly leadership. If you have leaders in place that accept science, that accept facts, that are willing to discuss this, that is already much easier. Because what's the point if you have great infrastructure, great digital solutions, if the leaders don't follow it? And it's difficult in Europe, because we see on one hand that some of the leaders have embraced evidence, while we also have seen populist responses with very little respect for facts. Second is, of course, the infrastructure and capacity. We have seen that some countries have rediscovered their public health systems in the municipalities, in the regions, but they all have also seen that the capacities are not good enough, because we have saved money on public health systems. So I think infrastructure and capacity here is very important. And last but not least, we need to get the balance right between the central and the decentralized level. So there's very often a bit of a conflict between the different levels: who is in charge, who's passing on data, who is having a say, who is implementing what sort of measures. And I think that is probably the third challenge. So leadership, infrastructure, capacity, and the balance between centralization and decentralization are quite key.
Great, thank you very much for that as well. My last question is related to what is the role of the non-government stakeholders in policymaking, and how can we involve them better?
I can only answer this question from the perspective of governments, because we are an organization which is a partnership between governments and academic institutions. But I think in the first place, it's really intelligence, because NGOs, civil society organizations, they have insight, credibility, which sometimes governments just don't have. They know about the constituency, the particular areas they are active in, and they have a lot to share on this one. Secondly, I think that civil society is also a great resource in terms of mobilization, you know, supporting, for example, testing, tracing strategies, or vaccine campaigns, or health promotion campaigns. I think that's it's a great role for civil society. Unfortunately, we see that during the pandemic, the space for civil society has not really grown, actually. And we also see that in some governments, the capacity to engage systematically with civil society is not well developed. So there's a lack of recognition skills, there's a lack of communication skills with civil society. So we can only hope that this will improve, because civil society is clearly a very important source for addressing health systems issues. And
with that concludes our interview. Thank you very much, Matthias, for your time, and thank you everybody for listening.
Great, bye.
Bye.